Thank you. At this time, we will take questions. So if you do have a question, I ask that if you please go to the microphone on either side of the room to ask your question. And again, for those of you joining via the web, you can also send in a question via the text box. Who would like to go? If you can go up to the microphone, please. Thank you. And please identify yourself and your organization.
I'm Eleanor Gayetan with the Coalition Against Trafficking in Women. It was a very moving presentation, especially moving to see you be moved by your own research. So I feel like really it's extraordinary that this report has also turned you all obviously into advocates. My question probably is answered in the first pages of the report that I haven't read yet, but are young people being exploited in the commercial sex industry ever not sex trafficking victims? You're distinguishing in the title between the commercial sex industry and sex trafficking victims. To the law, the Trafficking Victims Protection Act, TVPA of 2000, all minors who are exploited sexually are victims of sex trafficking. So I'm interested in the title. What are you suggesting about the difference between these two phenomena?
Thank you for your question. What we recognize that there has been discussion and dialogue over definitions and sometimes disagreement in the past decade. What this report focused on were primarily three areas. One is sex trafficking of minors. Two is the prostitution of children. And three is survival sex. We have in the report, in one of the appendices, I forget which one, we've talked through some of the definitional issues, and I think that it would answer your questions about where different studies have used different definitions and how we try to sort through that. But for our purposes, we are looking at any sex act where there is an exchange for something of value. And with this particular focus on, as I said, sex trafficking of minors, prostitution of children, and survival sex.
Next question.
Hi, Samantha Vardaman with Shared Hope International. I'm going to tag right on to Eleanor's question. Certainly as an anti-trafficking advocacy organization trying to streamline the understanding about child sex trafficking, we grapple with these definitional issues all the time. I was speaking with Jonathan earlier at the beginning of this, saying how we appreciated that was a focus in the report, that there was that clear grappling with definitions. From our standpoint, our concern is that when we distinguish between those three types or those three terminologies, which really all fall under the federal sex trafficking law and increasingly a number of state sex trafficking laws, we have the potential of not collecting all of the data consistently, and we have the potential of not treating all of these victims the same. And so I'm curious to hear how the discussion went with the committee in deciding to distinguish those terms, and then was there a consideration about the impact that might have on the other recommendations?
Sure. Well, I'm not privileged to talk about what the committee discussed and what individual opinions were. This is a consensus report, so where we came out at the end was with a viewpoint that we all agree with. I think it's important to note that part of our job was to look at the evidence. The primary job was to look at the evidence. It is certainly true that federal law has the definition that you mentioned, but it is also the case that some federal agencies define commercial sexual exploitation to include sex trafficking. And so there's inconsistency in definitions. It certainly feeds into challenges with research and data collection, and I think we highlight that in the report. I think ultimately we felt as a committee that it wasn't our job to sort out different definitions that are, as they're expressed in federal law, state law, different agency definitions, different definitions used by advocates, which may be driven by different motivations. What we felt was important is to identify that discussion, walk readers of the report through that discussion, and recognizing where the issues that arise out of different definitions are, and then focus on what we thought, based on our mandate, were the primary areas that we needed to look at and where there was a need for further examination. And those are the sort of 3 areas that we talk about in the report, and the ones that we focus on, the ones that I mentioned earlier today.
Next question.
You were there first.
Oh, that we're just doing every other. My name is Barbara Odekirk, and I'm an executive branch fellow this year, and I'm placed at the National Institute of Justice. And so I'm very interested in the commercial sexual trafficking literature, and I've been doing a lot of reading through there. And I heard you say during the talk that you are calling on OJJDP to sort of be a coordinator and help organize movements, including both prevention and responding to trafficking. And I'm just wondering a little bit about your decision to call on OJJDP, if part of what we want to do is really start recognizing that these kids shouldn't be in the justice system as perpetrators of crimes.
I'll take a stab at that. OJJDP does things for victims of crimes as well, not just focusing on perpetrators. And as one of the slides showed, there is this coordinating council that brings people together from across the government to try to pull that together. Getting multidisciplinary collaborative action in place here in Washington, in the federal government, in any state government, or any other bureaucracy is difficult. But in anything to do with abuse or neglect, it's critical. And everyone needs to work together, as the report said on this.
Next question.
Hi, I'm Carol Smolinski, the Executive Director of ECPAT USA. Nice to see so many friends in here. We've been working on this issue, of course, for many, many years. And so I'm actually delighted to have the report. I have a couple of questions, but let me just comment first that I understood when the IOM was commissioned to do this report that it would really cause a great increase in focus on the issue of commercial sexual exploitation of children and policy in the United States. And so I'm expecting to see that now. I just, obviously not having read the report yet, I support the recommendations. I think they're really right on from what I can see. I'm really excited about this. So 2 questions. One is just what happens from here? What do you see will boost the highlighting of this issue in the United States at the state level, federal level, policy, research, everything that you're recommending that has to take place? What's your role, or what do you at least see happening from here? Because I want to make sure that happens. Another quick question about boys, and I'm wondering, because we just published a report about sexual exploitation of boys in the United States, and what we're putting a focus on is how even more stigmatized than the issue of sex trafficking and sexual exploitation of girls is, that boys are really off the agenda. So I'm just wondering if you talked about that at all. And then finally, I just took a quick look on my YouTube app on my phone and didn't see the video. So I hope that you will give us a way that we can find the video that you just showed. I guess you said it was on YouTube?
It'll be on www.iom.edu.
Oh, I see. It's not on YouTube. Okay.
Let me take the 2 of them. First of all, we do talk about boys, and we do realize it's a tremendous issue. And so they are definitely what we're talking about. One thing about IOM committees is that when they deliver their report, they're done. And so, we've done the very best job that we can to develop a set of recommendations that we enthusiastically hope that others will pick up the ball and run with. I know what I'm dreaming about, but I know what happens with the committee, which is that it sunsets. Always makes me sad, but it's true.
I think that your question, Carol, about what happens next is an absolutely critical one, and I think that if all the people in this room and all the people on the webcast can take the report or whatever portions of the report speak to their audiences and really make sure that those recommendations get out and that the advocacy to make sure those recommendations are implemented is conducted, then we can have a ripple effect from the report out to the larger society at, every level, from the national to the low, the smallest communities, and that would certainly be a hope that that would occur as a result of the dissemination of the report.
I'll make one comment, which is that dissemination efforts are actually underway. That's one of the things, the next phase, which isn't a committee activity but an IOM committee, is to develop a variety of dissemination activities for this. So I think OJJDP has been really forward-looking in thinking and really providing money to think about dissemination so that this can have the biggest impact that it possibly can from this report. And then, and certainly we individually hope that it's going to have a huge impact.
Thank you. I'm going to actually go to my first web question really quick, and then I'll get to you. The question is, what about prevention efforts to children so that they do not turn into exploiters and traffickers?
Well, all right. We think that's a critical question, and we haven't seen any. It's a critical area of focus for research because we didn't see any evidence that would let us tell when those of us who are pediatricians walk around in a nursery or take care of children in child care, or teachers taking care of children, that you could look and tell who's going to become the exploiter and the trafficker. It is that kind of longitudinal research that is critical in all of these areas, because ultimately we have not only victims, but we have individuals who are behaving as adults in ways that were probably in part genetically determined, certainly environmentally and social influences on all of them, and how those come together and move along, we don't have the data yet to suggest, but it would be fabulous data to have.
If I could add briefly, it's one of the reasons also why we call for a multi-sector response. Certainly law enforcement plays a key role in pursuing and arresting purchasers and other exploiters, but as Dick said, we're looking long-term as well, and so we saw in our research and site visits, we saw an example in Chicago of a curriculum aimed at teaching boys more constructive, positive, healthy behaviors and attitudes, and that hasn't been evaluated. A common theme that you'll hear today is that we need to evaluate these programs, but it's a noteworthy example that merits a closer look. And so there are other sectors that might play a role in addressing some of the demand side and preventing over the long term as well.
Your question.
Hi, I'm Deborah Whitcomb. I'm a visiting fellow with the Office for Victims of Crime in the Department of Justice. And my role there is supposed to be to help make sure that our training and technical assistance efforts are evidence-based. So I'd like to follow up on your comments there about the absence of evaluation so far for many of the interventions that we're looking at, and yet the conundrum of wanting to create a database of interventions for providers, practitioners in the field to tap into. It's one thing to do that in medicine, where there has been a lot of research on different drugs and other interventions. It's another thing, even in the criminal justice system writ large, that there's not much evaluation. So how do we create a database that is useful to the field where we really don't have the foundation behind it to say that these interventions work?
Sharon, want to talk to that? No?
I acknowledge that this is a conundrum. And so, and I have to say that you gave great props to medicine, where we sometimes have less evidence than you think we do. But I think, I think that the way that we're going to have to go forward with this area is, in terms of creating resources, to be honest about what their limitations are, to pick up some of the call for evaluation of the responses of the efforts that are underway, and then just to sort of do this in a parallel process. I mean, what I think we can't do is to say, well, we can't do anything now because we don't have the data. That's not a solution. So what is a solution is to be honest about the quality of the data that we do have, to insist on valuation, put it out there, and then as we get more evidence, then refine what it is that we can do. I think that's what we have to do, because every day we don't do something, children are being victimized. I mean, and so I think that, we didn't find a lot of data, but we had some data. So there's something to move from. I just think humility about what we have, a call for evaluation, and moving forward to refine the tools that we do have to make them better has got to be the way forward, because standing still is not okay.
Thank you.
To build on that, when we talk about collaborating across sectors, we're also including academic institutes and research institutions. One of the things that we heard in testimony from service providers is that we've collected a lot of information or data, but we have no time. We don't have the time or resources to evaluate that and analyze it. And this is why partnerships across sectors are so important, and connecting people so that the people who do that well can do that, and the service providers can learn from that evaluation. I think it's related to another recommendation of ours, which is having entities across different sectors identify their core capabilities. What is it you do well, and figuring out how that fits with the solution. So healthcare professionals do what they do well, educators, school nurses, law enforcement, figure out what each sector does well, and I include in that researchers that maybe can't provide the frontline service, but they can help with the evaluation. So maybe we need to do a better job connecting some of those partners.
We have a few questions that came in from our webcast. The first is from Maya Brewer from the Substance Abuse Free Environment in Richmond, Virginia. She asks, is there any consideration for young adults over 18 who've been entangled in sex trafficking since they were minors? Sometimes individuals are in the system for years before they are discovered, and they really never get the help they need.
The committee's charge was to look at minors under the age of 18, but we did address in the report the fact that these young people go on to be young adults, and that the problems that they experience as a result of the crimes that they were victimized by when they were minors don't suddenly end at the age of 18. In addition, there are young people who may be victimized for the first time when they're young adults, age 18, 19, 20. And although we could not delve into that aspect of the problem in depth, the report does acknowledge that there needs to be attention to that age group as well as to those who are victimized when they're under the age of 18.
Here, another question from the web is, can the panel give us some characteristics of the most vulnerable populations, such as age, sex, ethnicity, urban versus rural, and socioeconomic class?
I think you saw in that diagram, we really are following an ecological model here and really trying to identify the risk factors. We saw individual, family level, peer and community, societal, macro level factors all being involved. We did highlight some groups based on our research that were particularly at risk. A lot of the children that we learned about were involved in child abuse and neglect, so they're involved in child protective services for one of those reasons. Some of them had been disconnected from their families and were without stable housing, or they were homeless. We also had children who were moved across different systems and not sort of having a consistent support system, right? But at the same time, in addition to those types of risk factors, we also saw kids who were in families who were involved in sexual exploitation and trafficking while living with their families. Either their families may or may not have known about it. So it really occurred across geographic areas, across socioeconomic status, across race and ethnicity, across age levels. So even though we did identify some risk factors, we really wanted to point out that it really occurs everywhere.
Next question over here.
Oh, thanks. I'm wondering if you're going to be willing to do this, but I'm curious if you, just as individuals, have talked about or have any ideas on why you think such an important and difficult social issue has been so far off the agenda in the United States, that it's just not something that we have talked about, that, you know, there's so much to do. Why has it been ignored for so many? I'm just wondering if you guys talked about that. You're, you know, been thinking about the issue for a couple of years. And
we did talk about it as a committee, and of course we can't talk about now what we talked about as a committee.
On.
But as someone who's done a lot of work in the field of child abuse, I think, and in the preface to this report, we went back a little in history. There's a phrase that a British psychiatrist used called gaze aversion. And given the opportunity to turn away from things that are unpleasant or difficult, most people, most agencies, most societies, and most governments will do so, and have done so for years. The interesting thing you said is, my observation is we do a lot better at addressing and raising money for health problems than we do for social problems in this country. And one of the interesting conundrums is when you have so many problems that are in fact socially based that you need to address, how do you raise money for them in a society that's more interested in its own health than its social problems? It's hard.
Next question.
I know I can speak for many advocates, including CATW, Equality Now, Shared Hope, ECPAT, Hunt Alternatives, Demand Abolition Project, in commending you for paying attention to the demand side of this issue. That might be the most intellectually, conceptually forward-leaning aspect of your report. You mentioned LexisNexis as one specific project that's doing something new in bringing accountability to perpetrators. Were there other examples you would flag as very important in confronting demand? And last point, thank you to OJJDP and specifically Catherine Pierce for for commissioning this report.
LexisNexis gave a presentation, which is why they were included in this. I think so I can say that that's sort of what's in the report. I think that I am hopeful that there are other examples. We also talked about the financial credit card company that was very helpful in this regard. I think there are real opportunities here to reach out to the commercial sector. Certainly the activities of ECPAT we highlighted a lot, and trying to reduce the opportunity for this to occur in our hotels and taxis and other things like that. We talked about Homeland Security and their position against this kind of activity on Amtrak. So we wrote about what we wrote about. I think there are a lot of opportunities going forward.
It looks like we are out of questions at this time, and we're nearing the top of the hour. So with that, I'd like to conclude today's briefing. Thank you again for joining us. And as a reminder, you can download the report, the video, and other related materials at www.iom.edu and www.nas.edu. And again, another thank you to the committee. We didn't say this at the beginning of the briefing, but they are all serving pro bono on this committee, and they've given a lot of time and service. So again, thank you all.
Okay.
Okay.